We can perform facelift surgery for sagging in the face. For patients with wrinkles or sagging that clearly descends vertically as a result of aging, particularly in the chin area of our face, sagging occurs due to the effects of gravity, skin looseness that hangs down as a result of sagging. To address skin laxity in the neck area and wrinkles that develop in both vertical and horizontal directions, particularly, we can perform facelift surgery if the patient is over 40 and their examination findings are suitable for it. Essentially, facelift surgery can be divided into subgroups. Among these, isolated neck lift surgery can be performed. Alternatively, we can conduct mid-facelift surgeries known as mid-facelift operations, or we can perform a total facelift. Sometimes it is necessary to combine lower eyelid and upper eyelid aesthetics with facelift surgery. The most common question patients have during facelift surgery is, will there be scars, doctor? In facelift surgery, we make incisions. Because we turn from the front of the ear to the inside and continue turning from the earlobe to behind the ear, this is related to the facelift surgery. You won't face any issues or troubles. In a total facelift, on average, one must take into account a surgery that lasts 6 to 7 hours under general anesthesia. In facelift surgery, we need to consider whether we will only tighten the skin or also the SMAS tissue beneath it for lasting results. Are we also going to tighten the muscle tissue we refer to as platysma? We will perform a tightening procedure. I usually suggest to my patients that while the surgical technique is more refined and detailed, it includes tightening the SMAS and Platysma tissue below. By tightening the SMAS and Platysma tissue and intervening in the Platysma, facelift procedures can take the patient back by 10, 15 or 20 years, and also make the results of the procedure long-lasting. If we were to say, let's just remove the excess sagging skin, according to my philosophy, this is not correct at all. The duration of the surgery was expected to be around 1 hour, possibly 1.5 hours, but a year later the patient will be dissatisfied with the results. It would happen. Thus, for this procedure to be lasting, we need to pay special attention to the SMAS tissues beneath the skin, which are responsible for keeping our skin taut. If we adjust and revise those tissues while performing this procedure, we will achieve a great result regardless. In this operation, we should be very attentive to the anatomy of the facial nerves. Surgeons who are well versed in the anatomy of this procedure will pay great attention to the transition points of the facial nerves, so the likelihood of nerve injury is very low. Therefore, the likelihood of experiencing issues like nerve injury or loss of sensation will be very low. The patient will spend 1 night in the hospital after the operation and will be released the next day. For approximately 10 days to 2 weeks, they will use a mask known as a facelift mask, and after about 10 days to 2 weeks, they can comfortably return to their social life. They can return to their social life comfortably. Naturally, they will appear younger, more lively, and more energetic.